Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let's begin by changing the way we look at the neck. Do not think of neck pain only as a tight muscle, a poor pillow, a long workday, or a posture mistake. Think wider. Ask, why does one person sit at a desk for 6 hours and feel only mild stiffness, while another person develops burning, persistent, exhausting pain? How can the same mechanical stress create such different body reactions? Look beyond the neck. Look at the immune system. Look at the gut. Look at the communication lines between bacteria, inflammation, nerves, sleep, mood, and muscle tone. Probiotics are not painkillers. Say that clearly. They are not a replacement for medical evaluation, physical therapy, strengthening, ergonomic correction, or treatment of nerve compression. But they may support a biological environment in which pain becomes less amplified, inflammation becomes less aggressive, and recovery becomes more possible. Why does this matter? Because chronic neck pain is often not only a local tissue issue. A systematic review and meta-analysis on systemic inflammatory markers in neck pain reported evidence of raised inflammatory mediators, including IL-1 beta and TNFR, in chronic neck pain states. That means the painful neck may be participating in a whole-body inflammatory conversation, not simply complaining from one isolated corner. So, when you hear probiotics, do not picture only digestion. Picture immune training. Picture barrier repair. Picture microbial metabolites talking to nerve pathways. Picture the gut as a control room that can influence how loudly pain signals are interpreted. Now ask the key questions. Why would bacteria in the intestine influence pain in the neck? How could a capsule, yogurt, kefir, or fermented food affect a muscle spasm between the shoulders? Let's develop that carefully. First, understand the pain system. Neck pain begins locally in many cases. Strained muscles, irritated joints, disc degeneration, poor workstation setup, repetitive phone posture, stress-related guarding, or reduced strength in the deep neck flexors and scapular stabilizers. Address those directly. Adjust the screen. Strengthen the upper back. Move your neck through safe ranges. Improve sleep position. See a clinician if there is arm weakness, numbness, trauma, fever, unexplained weight loss, cancer history, or severe progressive pain. But now go deeper. Ask, why does pain sometimes remain after the original strain should have healed? Why does the nervous system stay on alert? One answer is sensitization. The nerves become easier to trigger. The spinal cord and brain begin to treat ordinary movement as threatening. Inflammation helps drive that process. Stress chemistry helps drive it. Poor sleep helps drive it. Gut disruption may also help drive it. A 2024 systematic review and meta-analysis on gut dysbiosis in chronic pain found evidence that people with chronic pain conditions often show altered gut microbiota patterns, although the changes are not always disease-specific. In simple language, the microbial ecosystem in chronic pain often looks different from the ecosystem in people without chronic pain. Now ask, how does the gut speak to the neck? It speaks through immune signaling. A healthy intestinal barrier helps control what enters the bloodstream. When the gut barrier is stressed, through low-fiber diets, repeated antibiotics, sleep loss, alcohol excess, severe stress, or chronic inflammation, immune activation can increase. That activation may influence cytokines, pain thresholds, and tissue recovery. It speaks through metabolites. Beneficial bacteria can produce short-chain fatty acids such as butyrate, acetate, and propionate from dietary fibers. These compounds help support the gut lining and can influence immune balance, so do not take probiotics alone and ignore food. Feed the organisms. Use vegetables, legumes, oats, berries, nuts, seeds, and resistant starch. Give the microbiome material to work with. It speaks through the gut-brain axis. The vagus nerve, immune cells, endocrine signals, and microbial products all connect digestion with stress response and pain processing. This is why neck pain often worsens during emotional overload, poor sleep, and digestive disruption. The body is not divided into separate departments, it is one network. Now ask another question. What does the evidence say about probiotics and pain itself? The most direct evidence is not yet specifically probiotics for neck pain. Be precise, do not exaggerate. The evidence is stronger in related pain and inflammatory conditions than in neck pain alone, but those related findings matter because they illuminate mechanisms that may be relevant. A 2024 systematic review and meta-analysis of clinical studies on osteoarthritis reported that probiotic interventions, especially certain lactobacillus-based approaches, showed potential for managing osteoarthritis-related pain and inflammation. Osteoarthritis is not the same as neck pain, but cervical facet joints can undergo degenerative and inflammatory changes, so the connection is biologically meaningful, even if not definitive. Another systematic review on gut microbiota in chronic widespread pain and fibromyalgia included clinical evidence where a multi-strain probiotic intervention was associated with reduced self-reported pain and improvements in sleep quality, quality of life, anxiety, and depressive symptoms in fibromyalgia patients. Why does that matter for neck pain? Because chronic neck pain often travels with poor sleep, stress sensitivity, fatigue, and heightened pain perception. Pause here and make the practical point. Probiotics may help most when neck pain has a systemic pattern. Look for clues. Is there neck pain plus bloating? Neck pain plus poor sleep? Neck pain plus frequent antibiotic history? Neck pain plus inflammatory joint symptoms? Neck pain plus stress-related flares? Neck pain plus widespread tenderness? If yes, consider the gut as part of the plan, but do it intelligently. Do not buy a random product just because the label looks impressive. Choose strain-specific products when possible. The NIH Office of Dietary Supplements notes that probiotic effects depend on strain, dose, duration, and the individual using them. It also notes that labels should ideally list colony-forming units through the expiration date, not only at manufacture. So ask, how should someone use probiotics in a medically sensible way for neck pain support? Use this framework. First, define the goal. Do not say, I am taking probiotics to cure my neck. Say, I am using probiotics to support gut barrier function, immune balance, and pain regulation while I also correct the mechanical causes. Second, choose a cautious trial period. Consider 4 to 8 weeks. Track pain intensity, morning stiffness, sleep quality, digestion, headache frequency, medication use, and ability to move. Write it down. Do not trust memory. Pain memory is emotional and imprecise. Third, combine probiotics with prebiotic foods. Take action daily. Add fiber slowly. Use lentils, beans, oats, ground flaxseed, chia, asparagus, onions, garlic, apples, berries, and cooled cooked potatoes or rice if tolerated. Why? Because probiotics without food support are like bringing workers to a construction site without materials. Fourth, include fermented foods if appropriate. Consider live culture yogurt, kefir, sauerkraut, kimchi, miso, or tempeh. Start small. Do not flood the gut suddenly. If bloating or discomfort increases, reduce the dose and reassess. Fifth, protect the basics. Sleep 7 to 9 hours when possible. Hydrate. Walk, strengthen, breathe slowly, reduce ultra-processed foods, manage constipation. Why? Because the microbiome responds to rhythm, movement, fiber, and stress chemistry. Sixth, pair gut support with neck-specific rehabilitation. Do chin tucks if tolerated. Strengthen the lower trapezius and serratus anterior. Open the chest. Mobilize the thoracic spine. Take screen breaks every 30 to 45 minutes. Keep the phone at eye level. Ask, how can the gut calm inflammation if the neck is being overloaded every single hour? It cannot do the whole job alone. Now, let's address safety. For most healthy adults, Probiotics are generally well tolerated, with side effects such as gas or bloating. But do not treat them as harmless for everyone. The National Centre for Complementary and Integrative Health warns that risk is higher in people with severe illness or compromised immune systems, and possible harms can include infections or transfer of antibiotic resistance genes. So follow this command. If you are immunocompromised, seriously ill, have a central venous catheter, have significant heart valve disease, recently had major surgery, are undergoing chemotherapy, or are caring for a premature infant, speak with a qualified clinician before using probiotic supplements. Do not improvise. Also, ask, how will you know if probiotics are not helping? If after 8 weeks there is no change in pain, sleep, digestion, or stiffness, stop and reassess. If symptoms worsen, stop earlier. If neck pain includes arm weakness, loss of coordination, balance problems, bowel or bladder changes, fever, severe headache, or trauma, seek medical care promptly. Do not hide serious signs under a wellness routine. Now let's connect the whole picture. The neck is mechanical. The gut is immunological. The brain is interpretive. Pain is the language they may share. Probiotics can be beneficial because they may help reshape microbial signaling, support the gut barrier, influence inflammatory tone, and indirectly affect pain sensitivity. They can be effective as part of a broader plan because chronic neck pain often has multiple drivers: tissue load, nervous system sensitivity, stress chemistry, sleep disruption, and low-grade inflammation. Think of probiotics as one member of the recovery team. Not the surgeon, not the physical therapist, not the entire pharmacy. One member. Give that member the right jog. Tell the audience this clearly. Do not chase one magic answer. Build a biological environment where the neck can recover. Use movement to tell the tissues they are safe. Use strength to tell the spine it is supported. Use sleep to tell the nervous system to turn down the alarm. Use fiber and probiotics to tell the immune system to stop shouting. Use medical evaluation when the pattern is not ordinary. That is the strategy. So, why can probiotics help with neck pain? Because some neck pain is not only about the neck. It can involve inflammation, sensitized nerves, disturbed sleep, stress load, and immune signals that may be influenced by the gut microbiome. How should you use them? Use them as an adjunct. Choose carefully. Feed them with fiber, track your response, combine them with posture correction, strengthening, mobility work, sleep repair, and professional care when needed. Remember this final line: treat the neck locally, but support the body globally. Take care of your neck, take care of your gut, and take care of each other. We are learning this as a community, one topic at a time. See you in the next episode, family.